Welcome to Cert Review Exam 1. We're going to cover things in Chapter 1 and 3. So we're going to get into some calculations. We're going to talk about some just pharmacology, some general drug classes. So here we go. So I'm not going to show every problem, but I'm going to go over some general topics and that you can go off of. Okay. So the first one, it says we have a 14-month-old child weighing 22 pounds. Prescribed cefixime 150 milligrams PO QD. That means by mouth every day. Usual pediatric dose is 8 milligrams per kilogram per day. Is the dose too high, too low, just right? Let's find out. So remember, converting pounds to kilograms, a kilogram is heavier, so we're going to do 22 divided by 2.2. And we get 10 kilograms. And we're going to multiply that by the 8 milligram per kilogram per day. And we're going to get 80 milligrams per day. Okay, then we have to look at, okay, he's getting 150 milligrams every day. He should be getting 80, so it's going to be too high, about double. We'll do another calculation one. So a patient is prescribed to receive a dose of oxycodone, 5 milligrams, Q6, PRN pain. So how I'd read that is oxycodone 5 milligrams every 6 hours as needed for pain. The last dose was at 10:30 a.m. What is the earliest time the next dose may be administered in military notation? Okay, so every 6 hours as needed for pain. So that means the soonest he can take it is within 6 hours. So what is 6 hours from 10:30? So military time makes it very easy to do this calculation because you literally just take 10:30 plus 6 hours. Or 600, and that's 1630 hours. Which is the same thing as what p.m.? 4:30 p.m. 1630 minus 12 is 4:30. All right, next one. A patient is to get methotrexate 200 milligrams per meter squared. Okay, so this one might throw you off because it's in meters squared. It's based on body surface area, but I'll show you that it's just the same calculation that you're used to. Every 2 hours for leukemia. So a lot of cancer medications are based on body surface area. The patient's body surface area is 1.6 meters squared. What is the dose? Okay, so it says 200 milligrams for every meter squared. So you can set it up in a ratio and proportion. 200 milligrams for every 1 meter squared. But they only have 1.6 meters squared body surface area. What is the unknown? So 200 times 1.6 is 320 milligrams. So you can set up everything in a ratio and proportion and it will never lead you astray as long as you remember you must match the units all the way across. That is the golden rule of ratio and proportion. It will never lead you astray. A patient weighs 70 kilograms. How many pounds do they weigh? Easy peasy. You would just take the kilograms and multiply by 2.2 because I want you to remember this dumb little chart that I'm about to draw you, my little balance beam. I'm gonna make it nice and straight. Okay, this is a balance beam. You can imagine we have 1 kilogram on this side. And on this we have, and I'm gonna try to draw it to scale. This is pounds. So I didn't draw that as good as I wanted to, but this is 2.2 pounds. So remember, a kilogram is heavier because it takes 2.2 pounds to equal a kilogram. And so going from kilos to pounds is multiplying, going from pounds to kilos is dividing. You should get a smaller number in kilos, you should get a bigger number in pounds. A prescription for 2 tablets of ferrous sulfate, 325 milligram per dose. How many grains will the patient take each dose? So remember how many grains are in a milligram. So we need to take 325 times 2 because he's taking 2 of them. And reach into the depths of your brain and tell yourself that there are 65 milligrams in 1 grain. And that would be 10 grains. Okay. Prescription for azithromycin, 120 azithromycin, 120 milligram per dose. Azithromycin, 200 milligram per teaspoon. Okay. You are preparing it with 200 milligram per teaspoon. What volume will be given per dose? Okay, so the dose is 120. What I have in front of me is 200 milligrams per teaspoon. So remember, you have to know your conversions by now. Teaspoon, 5 milliliters. So I have 200 milligram per 5 milliliters, right? Because 200 milligrams per teaspoon. And on this side, I have 120 milligram. How many milliliters will that be? So 120 times 5 divided by 200. And that will lead you to 3 milliliters. Okay. Couple other just simple calculation problems, mostly about how many tablets will the prescription be, how long will the prescription last with a certain amount of tablets if the patient is taking so many a day. Remember, you have to know your conversions. You have to know what abbreviations mean. You know, Q6, BID, QID. Remember to tell yourself you need to know those. So now we're getting into more of concepts. So this one is about antibiotic and sulfa drugs. So a patient's profile lists sulfa. So they are allergic to sulfa drugs. Which of the following should not be prescribed to the patient? So our answer choices are Augmentin, Cipro, clindamycin, and Bactrim. And I want you to remember that Bactrim is a sulfa drug because Bactrim is the sulfamethoxazole and trimethoprim, kind of a complicated word, but it literally has the word sulfa in it. So when we get to brand generic for sulfamethoxazole and trimethoprim, that's Bactrim. So they should not be on Bactrim. A brand generic question to know what the drug Keflex is. And it sounds very similar to the name. It is cephalexin. Cephalexin. Okay. The other ones kind of sound similar, but just remember it's cephalexin Keflex. So this one actually is pretty personal to me because this is actually something that's affected someone in my family. Toxic blood levels of this antibiotic can lead to kidney damage and hearing loss. It's going to be gentamicin. So gentamicin, kidney damage, and hearing loss. There's a medical term for that, and it's ototoxicity and nephrotoxicity. So, the brand name for the antiviral oseltamivir. So, if you were in the retail pharmacy rotation in the fall, you probably saw a lot of this. And I want you to focus on this part, Tamivir. So the vir means that it's used for viral medications, and the tam kind of helps you remember the brand name. That is Tamiflu. This one, antiviral Viriad, is a nucleotide reverse transcriptase inhibitor. So it's a very fancy word about how it works against the virus. But it is going to be tenofovir and Disproxil. So I'm going to write it down. Viriad, tenofovir, Disproxil. Okay, another brand generic one. So this one, as a CPHT, you must offer patients counseling by a pharmacist. If you do not and the patient is harmed, this is a case of, and the good instance of this, or the good way to remember this, is you have to have that question with the patient. Do you have any questions with the pharmacist? And they have to say no. If they don't say no, then it's our job and our responsibility to make sure that they have an opportunity to talk to the pharmacist. So that's your job. And if it is your job and you should do it, not doing it would be negligence. And negligence literally means to not do your job. Not doing your job to its full extent. So what that means is, even if you are kind of doing your job, you're not doing it correctly, you're not actually asking all the questions that you should. That is an example of negligence. This question is about epoetin. So I'll write it out. Epoetin. And what it does is it helps produce red blood cells. So it stimulates the bone marrow, and the brand name is going to be Aranesp. Another brand name that's very common for this one is going to be Epogen. Yeah, Aranesp. For patients receiving chemotherapy, filgrastim. So, filgrastim actually helps to decrease their, their immune response, or I'm sorry, it helps increase the good immune response. So it's going to be increasing white blood cells. Another brand generic, and it is going to be about the drug infliximab. Infliximab. That's going to be Remicade. And if you can remember, that one is for the treatment of ulcerative colitis, I think, and it is for it's an autoimmune condition, and so anytime you see that MAB, it's for autoimmune conditions. So here we go. Here's a question that goes back to our cardiovascular brand generic quiz that we just took, and this is going to be Zocor. So the question says, if a patient indicates they are allergic to Zocor, which drug should they not be taking? And that's going to be the generic of Zocor, and that's going to be simvastatin. Okay. If a patient suddenly stopped taking a drug from one of the following classes for 48 to 72 hours, which would result in a rapid rise in heart rate, causing chest pain and a possible heart attack? So we have ACE inhibitors, diuretics, beta-adrenergic blockers, or calcium channel blockers. So the beta-adrenergic blockers is another way of saying beta blockers. That's going to be the one that they should not discontinue for 48 to 72 hours. If they just discontinue, a lot of the times their heart rate can, rapidly rise, and then they can experience signs similar to a heart attack. So the beta adrenergic receptor blockers, aka beta blockers. Omega-3 fish oil may be purchased without a prescription, but a prescription strength version is available under the name. So this one goes back to that one on your cardio quiz. It was about omega-3 fatty acids, and this is going to be Lovaza. Another brand generic, Coreg. Coreg is carvedilol. Remember, don't let that slip your mind. Be studying those. Always remember to ask yourself, okay, does that have a root word that I'm looking for to tell me what it is? Based on the LOL, you could tell me that is the beta blocker. This one is a patient struggling with obesity and delivers a prescription for Medidia. Medidia. That is going to be sibutramine. Sibutramine. So anytime you see that ending of the word amine or phentermine or anything like that, a lot of times these are appetite suppressants. This is going to be a Schedule 4 drug. So that does mean that it is regulated. It means that they have to have DEA number on the prescription. It means that, it has implications for the expiration. Be reminding yourself all the things that go along with class 4 medications. Okay, percent strength. I'm glad that there is one on here. So this drug is a 4% strength. How many grams are in 40 mils? Well, you know that percent strength is that number, 4 grams over 100 mils. And you need to solve for 40 mils. You're solving for x. 4 times 40 divided by 100 is 1.6 grams. I hope that you know how to do liters to milliliters. I hope you know how to do grams to kilograms. Remember, I'll just write it real quick. You have base units, grams, liters, meters, and then you have the prefixes, which change how many of that unit you have. You have things like milli, which means 1 over 1,000. You have micro, 1 over 1 million. You have kilo, which is 1,000. Okay, kilogram, that means 1,000 grams. Microgram, that means 1 over 1 million grams. So you have to remember, okay, which ones are big, which ones are small. Using that, it'll help you figure out if you need to divide or multiply. Whenever you see this, so if you see a colon, that means it's a fraction. So this is the same thing as writing 5 over 30. So 5 over 30 in a decimal form is 5 divided by 30 in your calculator. So that is 0.1666 yada 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 repeating. How do I convert that to a percentage? I just multiply by 100 or just move that decimal place over 2 times. And that turns into 16.67%. Okay? Anytime you see that colon, the ratio, that's the same thing as just putting the number over the other one. The name Lactobacillus is actually a name for a bacteria, which bacteria are good for you, or certain bacteria are good for you, in the form of probiotics. So a lot of the times when people are having issues with their GI system, they'll take these probiotics in hopes that it will restore balance to the gut bacteria that naturally is there. What common dietary supplement is recommended to help improve bone strength? And I hope that you know by now, things that are important for bone strength are calcium. So you should think of like milk. They also fortify orange juice with calcium as well. So bone strength is related to calcium intake. What dietary supplement is used to treat anemia? So the most common form of anemia is iron deficiency. I meant to put another M in there. That statement says iron deficiency anemia is the most common, and if it is the most common, what should you think that we're using to treat most anemias with? It's going to be iron. Ferrous sulfate, specifically. There are things like ferrous gluconate, and there's all kinds of different things, but as soon as you see that word ferrous, that means iron. Okay, so there is a drug that is used to treat opioid addiction, and it actually has an opioid in it, but it also has an antidote for it as well. I want you to remember the word Suboxone, and that is buprenorphine and naloxone. And that is for opioid addiction withdrawals. So, if someone has type 2 diabetes, that usually means that they are insulin resistant, which means that not all the times they need insulin. They usually will take an oral medication, but they might need insulin. The type 1 diabetes, so type 1 diabetes means no insulin is being produced. Okay, so if no insulin is produced, that means they have to have insulin to live. They have to have insulin to be supplemented so their cells can get sugar in and can work. So as soon as you see someone that has type 1 diabetes, you should think to yourself, okay, they do have to have insulin. The generic for glucotrol is glipizide. Okay, this is something that you should just know. I hope that this is easy to memorize because it kind of just is off and it's weird. Every time you see the drug levothyroxine, you should think take in the morning on an empty stomach. This drug is very sensitive to other things, so that means if the patient eats it with their breakfast, a lot of times the things in their food can actually interfere with the absorption of the drug and they won't get enough of the drug. And that can have implications on a lot of the things because of the thyroid medication. So when you think of taking Synthroid, you should think of, as soon as people wake up, and about an hour before breakfast. Okay. So this is something that I will have you sort of memorize, and it is the the amount of class 5 medication dispensing without a prescription. Now, a lot of states are changing the laws on these. But when you think of guaifenesin, I'm going to misspell this. With codeine, the maximum they can get is 120 milliliters. Okay, a lot of states are changing these laws, but as of now, 120 milliliters without a prescription. This person has a intense flu, and they are suffering diarrhea. The drug that they're going to use is actually a controlled medication called Lomotil. And if you want to know, the way I think of it is the process of the moving of the intestines is called motility. And if you want to slow down that motility, you would say it's low motil. That's just kind of how I think of it. But that's going to be atropine and diphenoxylate. Okay. Do not forget percent strength. And remember, percent strength is the percentage is the number of grams over 100 milliliters. So remember, me saying 5% is the same thing as me saying 5 grams over 100 milliliters, right? That's where I got the 5 from. You just take that number and literally put it there. A lot of people want to change that to a decimal. Don't do that. You will literally just take that percentage, put that number above 100 milliliters. And remember, when you set up a ratio and proportion, the most important thing you can do is match your units. Top, top, bottom, bottom. Amount of pseudoephedrine. So legal limit of PSE is the abbreviation for pseudoephedrine. Remember back in the SimLab days where we, had to have the person's ID, had to run it through the system, had to document it before they could pick it up. For a 1-day limit, if they're 30 milligrams each, pretty sure it is 3.6. So that would just be 3,600 divided by 30. So the limit, 4,380 milligrams, or 4.38 grams. Okay. Remember how many milliliters are in a teaspoon. Teaspoon, tablespoon, I think of them kind of at the same time. You have 5 mils in a teaspoon, you have 15 mils in a tablespoon, right? Because it takes 3 teaspoons to make a tablespoon. How should prescriptions for C2 drugs be stored once filled? So usually when this happens, you will have a separate receptacle for those medications. Sometimes it's in a safe, sometimes it's just in a separate bin that they eventually lock up at the end of the day. But just be sure that you understand that C2s, so Schedule 2 drugs, usually they're kept separate from everything else. So 3s through 5s, and then non-controlled, they're usually, they can be in the same place. Okay, so this question is having you take a percentage and go to a ratio. So it says hydrocortisone uh, 2.5% is what ratio? Now, if you want to, I give you multiple choice so you can work it backwards and you can just divide the first number by the second number and then get 2.5. But I'll show you how you can turn that into a ratio. So 2.5% is the same thing as 0.12, so 0.025. We're going to put that over 100. And we're going to put that over 1,000. 0.25 divided by 1,000. 0.025 divided by 1,000. And then that can actually reduce, 2.5, 100. So I just took that 2.5, I divided it by itself, and then I divided 100 by 2.5, and it can reduce into 1 over 40. So that ratio would just be 1 to 40. Like I said, I give you multiple choice, but if you want to save your time, which might be a good thing to get in the habit of, you can just do it like that. Okay. Here's one that's kind of interesting. Okay. I'll just write it out. In order to make a 1 to 40 ratio strength solution, how many mLs of water will be added to 12.5 grams. Okay, so 1 to 40, we have a ratio. We need to turn that into a percentage because the percent strength will help us figure out how many grams there are and then the volume. So remember, when you have 1 to 40, it's the same thing as doing 1 over 40. So 1 divided by 40 is the same thing as 0.025. And I need to convert that into a percentage. So 1, 2, that's 2.5%. Okay, now because I know what percent strength means, I know that that's 2.5 grams over 100 mils. And now I know that we need to reconstitute that whole amount of drug into a 2.5% solution. So this will tell me what that is. So I need to take 12.5 times 100, and I need to divide that by 2.5. That is 500 mils. Okay, that is the answer. Okay. So this one, it relies on understanding which drugs for anxiety are the least addictive. And when you see chlordiazepoxide, and that is an anti-anxiety, low addiction potential. Okay, osteoporosis paired with calcium, people with osteoporosis that take calcium, a lot of times they need something else to help them absorb that calcium and help them build their bones, and it usually involves vitamin C. So vitamin C is usually paired with calcium, in patients with osteoporosis. Okay, now this one is another important one because this one you will probably see on your certification exam just because it's so important. So there's a drug so prenatal vitamins literally mean pre-conception, like pre-birth. A lot of people think that it's something you just take while you're pregnant, but a lot of times it's really important that people take them before they get pregnant because there's a certain compound, a certain drug that actually prevents a terrible condition called spina bifida. So folic acid is actually a vitamin that helps prevent or helps lower the chances of something like spina bifida occurring. So potassium supplements. So potassium. So if we think back to the cardio chapter where I was talking about what a loop diuretic is, so like furosemide, it gets rid of water as well as potassium. So when people take things that are potassium supplements, a lot of times they need to start drinking water with that. They need to take a lot of water with it. Electrolytes, a lot of the times they have, they follow water. So whenever you think of potassium, you should think that the patient should be drinking lots of water. So that could be an auxiliary label that a pharmacist would put on that prescription. So when you think about ADHD medications, so ADHD, usually they are stimulants. I say usually because there is an exception, but usually they're stimulants, and usually they're all in Schedule 2. So when you see the drug Concerta, just think of methylphenidate. And you should also think Schedule 2. Okay. Topical medication over the counter for a vaginal yeast infection. So we'll get to this eventually when we start talking about like antimicrobials, but this is going to be something that is a sort of an azole for yeast infections. And the brand name is Monistat. Okay. And this is over the counter, but there are prescription strengths available. Many products available without a prescription are lower strength versions of prescription drugs. Which drug is available in both over-the-counter and prescription strengths? So one that you'll find a lot in the pharmacy, and a lot of times when people in the hospital, they have a headache or maybe, whatever, they might be taking this drug, ibuprofen. A lot of times in the hospital, we have prescription strength, and it comes in 600 up to 800. And if you go and look on your medicine cabinet, usually you'll find that there are 200 milligrams. So it's the equivalent of 4. What over-the-counter cold remedy has restricted sales due to abuse by adolescents? Those darn kids. This one's going to be Robitussin DM. So Robitussin DM is restricted. We'll call that behind the counter. A favorite pharmacy reference on generic substitutions that is organized by anatomical systems. So this one is one that's kind of being phased out by things like Lexicomp and Micromedics, but this is drugs, facts, and comparisons. So drug, facts, and comparisons is listed by anatomical system. So learning drugs by their anatomical classifications, just like I was just talking about with the references, not only can it help you find a drug in the drug reference section, but it can also help you learn the pharmacological action. So meaning like what it does in the body. And then you can start thinking about, okay, if it's doing that, what are some side effects? What are some things that patients are going to complain about? Things that you can help with the pharmacist, trying to figure things out. Obviously, you are not to use medical judgment. That's for pharmacists, but it doesn't hurt. It just helps speed up the process. A pharmacy technician that is pregnant should not handle this due to risk to the fetus. So that is going to be the drug finasteride. Harmful. Oh, oops. So usually what will happen is if this needs to be dispensed, usually a male pharmacy technician or a pharmacist would dispense this, or someone who is not pregnant. It's really not super, like it won't jump out at you, but this is just a precaution because it can be harmful to the fetus. What auxiliary label should be put on hydrochlorothiazide or furosemide to help avoid potassium loss? So just like I said, those are loop diuretics and they actually waste potassium. So what is the best source of potassium in people's diet? That's going to be take with a banana or maybe some orange juice. What is the generic form of aldactone, which is a potassium sparing diuretic? So aldactone is spironolactone. Spironolactone is aldactone. What is the generic of Flonase? And many of you have seen this because you may have used it yourself for, allergies. This is going to be fluticasone. Fluticasone nasal spray. Which bronchodilator is fast acting and used to treat an acute asthma attack? So this means that it is rapid use. So something you need immediately. You should think of a rescue inhaler. This is going to be something called ProAir or albuterol HFA. So this will be an inhaler. This would be an MDI. And if you remember what that means, MDI means metered dose inhaler. And like the question says, used for acute situations. So this is something that they really need it right now, rapidly. This is not something that they use every day. Last question, which is a non-sedating antihistamine over the counter for allergy relief? So non-sedating, meaning it won't make you drowsy. Antihistamine, over the counter. This is going to be loratadine. You always see on the boxes of which, by the way, this is the generic form of Claritin. You always see on the boxes, non-drowsy, all that stuff. It's because it is a non-drowsy antihistamine. Before this drug came out, primarily there was just Benadryl, and one of the side effects of Benadryl is that it makes people sleepy. So that's kind of one of the side effects that they didn't like. So this is the last question. Make sure you review. I did skip quite a few of the math problems because they were repetitive. So make sure you are aware of all the math we covered. Make sure you cover your, the conversions list. So tablespoons, teaspoons, ounces, milligrams, kilograms, pounds. Then, obviously don't forget percent strength. That should be in the back of your head. And you should do fine. I think you'll do great on this exam. If you have any questions, just let me know. Thanks for watching.